If you connect with your patients where they feel truly cared for, the outcomes, which are the most important thing, are actually better.
Compassionate medicine, this time on UCLA Newsweek. Also, calculating extinction rates and expert analysis of Mideast policy. The new book, Prescription for Excellence, outlines the principles that have made UCLA renowned for clinically excellent patient care. Dr. David Feinberg, CEO of the UCLA hospital system, outlines his approach to treating illness.
When I had this new opportunity 4 years ago to be in charge of all the UCLA hospitals, I learned two things by really sitting down and listening to patients. I learned that we perform miracles and do things that other places can't. That's what's made us famous. But I also learned that we had many areas where we had not focused or gotten sloppy. From a patient standpoint, those great technological advances are important, but they're not sufficient to really heal somebody. So to me, it became very clear that we had to add compassion back to what we're doing. And we didn't do that to make money. We did it because it is the right thing to do. The results have been great from a financial standpoint, but it's clearly not what led us on that mission or what keeps us driving. What I want is for all patients to feel like they have a navigator that will help them get through the system. I want everybody to be cared for like they're in my family. I want everything explained in a way that they understand. I want them to partner with their provider in care. If you connect with your patients where they feel truly cared for, the outcomes, which are the most important thing, are actually better. They become better patients. They really partner with you in their treatment. Better adherence to medication, better understanding of their disease, better prevention measures wherever they are as far as their health care. So good care equates to better outcomes. And we believe that we got to do that with every patient, every day.
Ecologist Stephen Hubble has co-authored a paper which argues that faulty science has led to overestimation of global species loss, while maintaining that the extinction crisis is very real.
Can you tell me a little bit about the species-area relationship method?
Before I do that, let me just say that we have a serious extinction crisis in the world. And so there's tremendous pressure on the community of conservation biologists to figure out how many species are being lost to help in conservation planning. Now there's one method that's been used more widely than any other, which is called the species area curve relationship. And basically this is the idea that since species don't live everywhere on the surface of the earth, you can count up how many are in a particular area and then expand this area, adding a new species every time you encounter a new one. And the idea was that we could simply reverse that process of capturing species, reduce the area, and figure out how many species would be left. The problem with this method is very simple to explain. All we have to do to increase the count of species is find the first individual of a new species that we hadn't seen before. But in reverse, we have to eliminate all of the individuals of a species to call it extinct. And it's the difference between those two things, what's called the area of first encounter and the area of last encounter, that creates the problem. I know this is hard news for some conservation groups, but the answer is that science is a self-correcting process. And we need to, when we find an error, we need to correct it because we need the very best science we can possibly have to guide our conservation planning.
After Barack Obama's recent speech on the Middle East, expert James Gelvin analyzes the possible effectiveness of the president's policies.
There are several problems with what he was calling for. First of all, he called for a $1 billion debt relief for Egypt, which sounds sizable, but Egypt's debt to the United States is about $10 billion. Add into that the fact that Egypt usually makes about $12 billion a year off its tourist industry, which has come pretty close to collapsing in the recent period. So the debt relief that Obama is promising is going to be swallowed up very, very quickly. In terms of the economic reform, there's two problems with what he's doing. He has said that he would like to invite the IMF and the World Bank in to look over Egyptian finances, to liberalize trade, to further the privatization, and so on and so forth. The problem is that they've been down that road before. As a matter of fact, you can say that the rebellions were rebellions against those very policies. The Egyptian population, there's a large unemployment rate amongst particularly the youth population. Many of the guarantees in terms of education and healthcare have gone by the board. The subsidies on food and petroleum products have been pretty much abandoned and are now targeted only towards the very poor. This is what neoliberal policies are felt. This is how they're felt in the Middle East. They're felt with a great deal of resentment.
For more on these and other stories, visit newsroom.ucla.edu and peep the tweets at UCLA Broadcast.